Hi, everyone. Welcome again to day 2 of the summit, and thank you for joining this session on the lived experience, overcoming challenges to treatment and care. I'm Rhea Racho, the Hepatitis B Foundation, and I'm really excited to introduce to you our 4 incredible panelists who will be sharing with us their personal experiences and insights living with hepatitis B and TB. Throughout our discussion today, we're going to try to highlight some of the main challenges and barriers that people living with or at risk of TB and hepatitis B often have to face when they're seeking access to healthcare, prevention, testing, treatment, and support throughout their patient journey. And we will also be discussing strategies and recommendations for how to address these challenges while centering the community and centering people with lived experience. So each of our 4 panelists today, Alice, Honda, Richard, and Tenzin, will have an opportunity to introduce themselves in more detail and share with us about their story before we jump into question and answer. So we have discussion questions lined up, but you are also welcome to add any questions at any time into the comment box, and we'll get to them as we go throughout the session. And I did also first want to give a little bit of background on the storytelling initiatives that each of these 4 panelists are a part of, to give a shout out to We Are TB, the Just Be campaign, and Hep Free Hawaii's storytelling campaign. So Tenzin and Honda are a part of the We Are TB network, which is a network of tuberculosis survivors and advocates that is fighting to achieve change in TB diagnostics, treatment regimens, and funding to support public health programs for TB. And then we have Alice, who's joining us, who's a volunteer locally with our Hep B United partner in Sacramento, but also with Just Be campaign through the Hepatitis B Foundation. And Just Be is the national storytelling campaign of HBF that aims to empower people with lived experiences to share their Hep B stories, to help break down stigma and raise awareness and improve advocacy efforts. And then we have Richard, who is, we had the privilege of meeting through Hep Free Hawaii, another awesome HBU partner, and he has told his story locally, and I believe around the country too. And so thank you all for being part of these storytelling campaigns, and we're excited to hear more about each of you today. So I'm going to go ahead, and now I'm going to ask each of our panelists to just tell us a little bit about them, their background, where they're from, where they live right now, and a little bit of an intro to their connection to hepatitis B or TB. And I will start it off with Tenzin.
Excellent. Thank you so much for the warm welcome, Rhea, and thank you for this opportunity to speak. So my name is Tenzin, he and his pronouns. I live in Madison, Wisconsin, and I grew up initially in southern India in a resettlement camp, a Tibetan resettlement camp, and then immigrated to the U.S. when I was 6 years old. And so as far as my TB and my experience with TB, initially started experiencing symptoms in my senior year of college, and this was 2012 in the fall. And so first it was probably around November of 2012 when I had a lot of chest pain and had a really dry cough, and got that checked out, and this continued for a while where they weren't able to identify what the issue was. And it wasn't until April of 2013 when I finally got diagnosed with MDR-TB. And I thought this was, unusual, but it doesn't happen to too many people. That's what I initially thought. And so, it took, so many months of feeling very ill to the point that coughing and sneezing and laughing would even hurt. And even walking around campus was a struggle for me. And so with that, I began treatment and had a lengthy isolation and treatment process where my isolation was, I was in isolation for 139 days, and my treatment process was a total of 28 months. And so this is for MDR TB. And so when I reflect back on some of my treatment, that process, it was incredibly difficult with all sorts of different side effects, from nausea to anxiety to peripheral neuropathy, and had all sorts of different issues throughout my with a constantly changing regimen as well. Some of the scariest parts, I would say, were also just the certain drugs like ethambutol. There was a point where my vision was actually it got so bad within just 2 weeks that it went from 20/20 vision to not being able to distinguish someone's face that was maybe 15, 20 feet away. And so luckily I had care and people were monitoring my vision and hearing and on a regular basis, and was able to quickly change me from that medication. But those are some of the scarier side effects, and there's irreversible damage that can be done because of them. But because of everything that I went through, I got involved with. I went to this conference. It's for survivors, and I had no idea what to expect. And it was there I really learned about the experiences of people with TB that are going through TB treatment, and also the post-treatment effects as well. So I learned that it's fairly common, unfortunately, for delayed or misdiagnosis, and I learned about all the mental health challenges, as well as the stigma that people experience, and the strains in people's relationships, and the potential financial stress as well, to experience such a transition and a lot of uncertainty during a time. And all that to say is it really encouraged me and was a catalyst for me to that kind of experience to really get engaged with some sort of advocacy related to TB. Because despite me finally learning a lot more about TB post-treatment, actually, it was my dad and my brother also had MDR TB. Because of some of the stigma that existed, and perhaps also because of my age, I really didn't learn too much about TB growing up. And so from then on, I've been involved with We Are TB, survivor-led advocacy group, also serving on WHO's Civil Society Task Force. And this year I'm a mini grant awardee, so with TB Elimination Alliance and APCHO. So very thankful for all the support and excited about all the work ahead. And there's so much work to be done, especially in Asian American communities, and particularly in my Tibetan community. So I'm excited to bring more awareness about TB, and especially latent TB. And so I think that goes often unaddressed. And last year, I remember Dr. Lebu was speaking and shared that 80% of active TB in the US is from long-standing latent TB. So especially to address TB in the US, it's so essential that we think about latent TB, and particularly in more vulnerable communities. So I'll stop there, and I'm sure there's going to be a lot of questions, and happy to share later. Thank you.
Thank you so much. Yeah, we definitely are going to want to follow up on some of the really important points you made there regarding stigma and just some of the support that's needed and the challenges that people go through. So next, I want to introduce Alice and give her a chance to share her story.
Good afternoon, good morning, everyone. This is Alice Chan. As Ria was talking about the Just Be Story campaign, and I am one of the Just Be storyteller from the 2018. I'm from Sacramento, California, and I was born and grew up in Hong Kong. And my background experience is a registered nurse and also a public health nurse. So I was diagnosed with the Hep B during my first pregnancy. I learned that I probably contracted the virus from my mom when I was born. And then after I learned about I have the hepatitis B virus, I was so scared and kind of like not worried about myself initially. I was worried about the newborn. So, but very fortunately, my OBGYN knew what to do and take the protocol to protect my children to be getting the mother-to-child transmission. And so kind of like in a Chinese family, talking about illness, especially, in my family that I was raised, talking about illnesses is taboo. And then after I find out, I have the HPV, I have been very open with my children about the disease, even though I still feel like there's a lot of profound stigma in myself. And so I become very passionate about educating, the Asian American and Pacific Islander community about the HPV prevention and also especially the perinatal transmission. However, because of my profound, kind of like the upbringing experience of being kind of with the stigma and the fear of isolation and the shame of have the HPV, even though with educating the community on my own, I never disclosed my HPV status. So kind of like it's a catch, because I never feel comfortable that I want to bring forward, with my kind of diagnosis. And however, another thing I want to bring out is I was very grateful with Dr. Moon Chan from UC Davis. He's a professor for the cancer control in UC Davis. And he's also a partner of the Hepatitis B United Coalition, connected me with the Hepatitis B Foundation. And with the storytelling, kind of the workshop and the campaign, I become so comfortable being able to kind of expose myself that I am living with the hepatitis B. And I'm a chronic carrier. And now here I stand here to share my information with you, and hopefully we'll be able to save life, and especially, HPV can lead to liver cancer. So once I get connected with Hepatitis B Foundation, that opened doors for me to continue my path, for the HPV elimination and extend my outreach to a bigger and larger, populations. So it was really grateful and thankful for Hepatitis B Foundation and United, what they have done and get me, connected and the opportunities. So for all the community outreach work that I have done, and after I found out I'm the HPV carrier, then I did a lot of health fair and to educate, the community, and also particularly in the Chinese language school. So I educate the parents, about the perinatal transmission, because I don't want, the family to repeat, what I have. And fortunately, my children are protected, and they are, at newborn, and they are all happy, negative. And my background experience, work experience is working for the Refugee Health Program in the California Department of Health Services. And then for the assessment of the newly arriving refugees, in the 90s. And that was a turning point of my professional career, because I really love and ambition about what I have done at that time regarding the TB and also hepatitis B screening, and the follow-up. And especially at that time, with the TB, LTBI, and then they do the direct observed therapy for the LTBI, people, refugees, who determined to have the PPD skin, PPD positive. So that was a very great experience. and everybody has to went through the hepatitis B screening, to make sure that they prevent the transmission and also have the vaccination. So another highlight I want to bring out to you is just within the last 2 years, through the hepatitis, through the in UC Davis, the End HPV project, that I was able to be part of the health HPV education to the Hmong population in the Sacramento area. And then with the support of the federal qualified health centers. And so that was a great experience to understand the community, the Hmong community, how they deal with HPV and their knowledge and their understanding. So that was grateful to be part of it. And then the recent project, community project I have done is the UC Davis. They host a COVID-19 survey and also incorporate HPV knowledge and their understanding and their follow-up in the survey. So that is a very good kind of like the venue for them to get more information, to tag on to the COVID-19. That is a good learning experience when I was a surveyor, to survey the community, the Vietnamese and Chinese community about the COVID and also the HPV. And one of the grateful projects that I have recently, just about 6 months ago, is the Happy United and UC Davis. What they have done is to kind of like solicit, me to organize a focus group in the Chinese American community in the Sacramento area to discuss about HPV and the liver cancer and their understanding. So I really appreciate, all this opportunity UC Davis and Happy Foundation and United provided to me. And so my passion will continue, and we're grateful to be here. Thank you.
Thank you so much, Alice. And yeah, I know we'll also have many follow-up questions for you based on both your personal experience and all that experience working at the California Health Department too, about addressing these, both Hep B and TB. So next, Handa, I'd like to ask Handa to introduce herself as well. And she was kind enough to join us all the way from Uganda. So right now, I know she said she may have some connection issues, but there she is. Just in case she drops off, we'll get her back going when we can.
Yeah. Hi, everyone. Thank you so much, Ria, for welcoming me and also the fellow TB advocates today. My name is Handa. I am from Mongolia. However, I'm currently based in Kampala, Uganda, working on humanitarian projects. I'm actually right now in the western region of Uganda called Kiryandongo, a few minutes away from refugee camps where a majority of the refugees from South Sudan are residing currently. So I'm providing humanitarian support here. So apologies if my internet connection becomes an issue. So as mentioned, I am Handa, I'm from Mongolia, and I am a TB survivor and TB advocate. When I was 15 years old, I was diagnosed with pulmonary tuberculosis, and I was hospitalized in a TB clinic for 2 months, and my treatment continued for 6 months in total. And before I dig deeper into my story, into my speech, perhaps I should share a brief story, and that should illustrate the types of challenges that I overcame and battled and now trying to raise awareness on. When I was first diagnosed, my mom and I went to a local TB clinic in Mongolia. And when we went to the local clinic, met with the doctor, and we received my TB diagnosis. And my mom and I, when we left the doctor's office, we were handed a patient logbook, book. And in that patient book, I noticed that my whole diagnosis was summed up with only one giant letter, and that was S. S stands for Suriye, which means tuberculosis in English. I was very curious, and I was only 15 years old, so I asked my mom why the doctor didn't spell out the whole name in my patient book. And that's when my mom explained to me for the first time about tuberculosis stigma and discrimination. She explained that doctors do this for TB patients to protect them from potential stigma, bullying, and discrimination. At that time, of course, I was only 15 years old, so I was very happy to hear that the health sector, the medical professionals are trying to protect us from stigma and discrimination. However, years later, I realized that it wasn't actually a real protection. It was simply a Band-Aid. It was a way that the medical professionals were accepting that TB is a stigmatized illness, and they were actually complying with TB stigma by encouraging me to hide this from others. So after that point on, my family, my parents, and myself decided to hide it from everyone else. I told my classmates, my teacher, everyone that I was going to China to travel for 2 months, and then I packed up my bag and stayed in a TB clinic for 2 months. And the sad part was in the TB clinic where I was staying, the pediatric ward, everyone was facing the same issue. They all hid their diagnosis from relatives, from their friends, classmates, and teachers. And they were only powering through this with only their parents. For those who don't have parents alone, it was the sad reality of a TB clinic at that time. So I hid this about this disease for 10 years. And during these 10 years, I spent a lot of time abroad, witnessing so many different stigma that exists in cross-cultural contexts. And along the way, I realized that I cannot be silent anymore, because by being silent, I was simply complying with the stigma. I was simply complying with those who stigmatize others based on their illnesses or struggles that they are going through. Which is why a whole 10 years later, I decided to write a book, a memoir about my story, overcoming tuberculosis and the attached stigma and discrimination. This pushed me to join TB advocacy field as well. And now I'm currently a Global Fund Advocates Network speaker. I'm also part of We Are TB Network. I'm also part of the TB People Global Network as well. I really understand that it's important to raise awareness, because if we keep being silent, this issue is going to continue and hurt so many little children like I was when I was 15, and their confidence, and that shameful feeling that you have something to be afraid of. You have something in yourself that's shameful that you have to hide, which is not true, because TB is not something to be ashamed of. It's simply an illness. It's simply a disease that anybody can get. It's not connected to someone's worthiness. It's not connected to someone's socioeconomic status. It's not connected to anything. It's simply a disease. And this is why I decided to raise awareness. And in my country, it's still a very stigmatized illness. And as far as I know, I'm the first Mongolian TB survivor to speak up openly and honestly about my story. I started a small Facebook group on Facebook, on social media. And the sad thing is sad in one part, but it was also great that many TB survivors and patients started reaching out to me saying, Handa, I experienced what you experienced. I'm currently experiencing what you are experiencing, but I can't speak up. Thanks for speaking up on behalf of us. Can you please add me to your Facebook group so I can connect with the fellow TB survivors and patients in a safe space? However, the major thing that they ask me to do is not to tell anyone about their disease, about what they experienced. This is the sad part that I was talking about. Even though they reaching out to me is a good news, that the fact that they're asking me to hide it is showcase that there's still stigma, there's still discrimination. This is why I'm here today, speaking with you all and contributing to the global TB advocacy field and destigmatize this disease so that people feel empowered to share their stories openly without feeling shamed, and most importantly, feel confident and feel like themselves, right? Before who they were, before TB happened. So with that, I will hand it back over to Ria, and happy to be here. Thank you.
Thank you so much. That was really, I think you articulated so well, like how from the very beginning, how they received their diagnosis of TB or similarly with hepatitis B can, I guess, frame the way they view the illness for the rest of their life, and whether they can find information about it or find acceptance for their diagnosis. I'm glad that you were able to and are fighting for the destigmatization of it. So thank you for all of that. And next we have Richard. There he is. And please share with us a bit more about yourself and your story.
Okay. So my name's Richard Smith. So I'm originally born in El Paso, Texas, raised in the suburbs of Detroit. So my mom and dad met when he was stationed in Korea while serving in the Army. Currently living in Michigan, again, to take care of my mom due to post-liver transplant complications. But I lived in Hawaii for 21 years, also in San Francisco for about 3 years. My main background is actually in food and beverage. I also volunteer with different organizations such as Hub Free Hawaii, also the Imperial Court System, which is one of the oldest LGBTQ plus organizations in the continental, in North America. There's 70 chapters that started in San Francisco and exist now in Mexico and Canada in addition to the US. Normally we're a resource for people living with HIV and AIDS, as well as Native Hawaiian cultural study grants. We've been doing this since 1981. Most money is raised through crowdfunding, drag shows, as well as virtual events due to the COVID-19 pandemic. I found Hep Free Hawaii just by chance because there's not enough information that was really being given to me due to, like in the gay community, for instance, the main focus is usually on HIV, how to prevent it, how to be treated if you're infected and whatnot. So it was just a lot of Google searching, and I came across some stories online, and that led me to Hep Free Hawaii, and I've been affiliated with them ever since. So what I'm hoping to do is to be somewhat influential to others, to maybe after hearing my story, they'll be able to reach out, get some information. They can see what early testing can do, education, and also see where there's lacks or holes in our system, including with insurance and some lack of support programs. My first experience with hepatitis was in 2004 when my ex-partner passed away from non-viral hepatitis due to alcohol abuse. This was followed by other traumatic events, which for a long time believed my future would lead to the same as my family members. My diagnosis with chronic HBV was in 2009, and when I and family members were being tested for possible blood and live liver donations for my mom's middle sister. She was not aware she was chronically infected with hepatitis B, and she was experiencing liver failure. So during the screening process, my doctor had called me on the phone after doing my blood work and just blurted out, "When were you going to tell me you are infected with hepatitis B?" And that was a complete shock. She followed up that with, "Just so you know, I've already reported your situation to the Hawaii Department of Health as required by law." So it was kind of a cold introduction to all this. The diagnosis hit pretty hard because the only experiences I had was with my ex as well as my aunt going through liver failure. My employer sensed something was going on with me, so I had disclosed my status, and then they weren't sure if I could continue working in the food and beverage business because of that. They're just not knowledgeable enough about the different types of hepatitis And what they were thinking was an issue was more about hepatitis A than B or C. So once they found out, got educated and whatnot, and the restaurant owners being of Asian descent themselves, they decided all to get tested as well as get vaccinated. My treatment was actually referred out initially to the Hawaii Liver Center, which was an independent organization headed by Dr. Naoki Sai and Dr. Robert Zhao. I was very fortunate to be paired with Dr. Zhao. Shortly after, the Liver Center had lost their funding and was dissolved, and my care was referred out yet again, but I chose to stick with Dr. Zhao as main practice. Initial treatment for my chronic infection was supposed to be interferon treatment. However, just before I was getting ready to fill my script, the FDA finally approved Variad for first-line treatment. And that was great, not having to give myself injections and whatnot, but that became very costly. Initially, $250 deductible per month just for to control this virus. 2011, I moved to San Francisco. My primary care physician was with Kaiser Permanente, happened to be an HIV specialist, and he was very concerned that I was taking tenofovir as a solo treatment, being in what they call a high-risk category, being a gay male. And his concern was that I was taking an HIV medication. So if I became co-infected with HIV, that I could become resistant to treatment. So that's when he recommended putting me on PrEP or Truvada. He pointed out it's the same amount of tenofovir in the PrEP. And by doing this, it would be killing two birds with one stone. Shortly after that, my insurance changed over to Blue Cross, and I went over to UCSF, who I was seen by Dr. Nora Terrell. She was the head of the program there. So she agreed that she should, or they would continue my treatment with the Truvada to see how it goes. I was on that for years. My viral load never could get down to zero. And they're just dumbfounded by it, sent in my blood to Gilead to see if there was any kind of resistance issues, whatnots, and apparently there was not. One of the pluses with switching over to the Truvada was that there was a copay assistance programs available, so which they put me on, and I was able to get my medications for free. And so going back to the medications again, when I came back to Hawaii in 2014, my Dr. Zhao looked at my records and saw my track record with my viral loads going up and down, and decided that he would put me on dual treatment with entecavir and see how I respond to that. It took about 3 weeks of appeals with Blue Cross, going all the way up to the CEO of HMSA, which is Hawaii's branch of Blue Cross, for me to even get the script filled. Additionally, there was issues with the switching over to Descovy. And every time I have to get the prescription renewals, I have to go through this process. They're not, for some reason, not agreeing with the course of treatments my doctors have chosen. So right now, being in Michigan, trying to use Blue Cross and everything, I'm actually in another issue with the insurance again, because my copay assistance for the entecavir is being challenged. So we'll see. Otherwise, I'm going to be having paid $100 per month for that. So at the beginning of my journey with hepatitis, as I mentioned, my aunt was going through liver failure. She didn't have medical insurance, and she was also This was also during the recession, and my aunt was a small business owner in the city of Detroit. She had immigrated from Korea in the mid-'80s, came with a mindset of being self-sufficient, not having to depend on family or any government programs when she finally became a citizen. Times were tough during the recession, which also, times were tough, bills were adding up, they had the choice of opting out from paying into Social Security. They also canceled their medical insurance. They had 2 kids, one in high school. They also had one in college. And during the whole process of her liver failure, we were getting calls about billing and whatnot. Her care had already reached up to almost $1 million. So in order to get that squared away, of course, my aunt was going to have to go on public assistance. This was very challenging, being that my uncle's native language is not English, it is Korean. The whole process of getting paired up with different programs through the state and federal, it's just almost next to impossible. It kind of doubles the amount of time needed. With the way that it was explained to them and the way they understood it was that they had to liquidate everything, all their belongings, the home they worked for, their business, drain their bank accounts. And so they pretty much lost everything because of this. Her whole life, what she worked up for, it was just all gone. And they had to provide receipts to show that all that money that was gained from the sale of these items was used towards her medical bill first. They are currently living with my mom's youngest sister in her condo. Well, they're living in my aunt's condo right now while my aunt is taking care of my grandmother, who was just recently diagnosed with dementia. So towards the peak of my aunt's situation, my mom's condition was worsening. She started treatment too late because, again, our diagnosis came a little bit late. My mom already had cirrhosis. They were looking at her very closely because they didn't want her to experience the same thing my aunt went through. In 2015, they discovered a mass in her liver, but it was caught early enough. But a decision had to be made, and they chose to put her on a transplant list. Shortly after being put on the transplant list, unfortunately, she was diagnosed with breast cancer as well. So they caught that early. 1 year radiation and chemotherapy. She beat the cancer. She then had to wait about a few years before she could be put back on a list with UNOS. And a few months after being put back on the list, she got her new liver. So we're all jumping for joy, thinking, okay, this is going to be great for her and everything. But unfortunately, that was not the case. I was furloughed, still living in Hawaii, furloughed from my job due to the pandemic and whatnot. And so I was not really brought up to speed about what was going on with her care. So she went through some issues with a biliary mismatch, and that needed to be addressed with a stent, which then perforated her bowel, and caused a whole mess of issues. But so I'm here taking care of Mom, and just taking it a day at a time. So thanks.
Thank you so much, Richard, for sharing. There's such a range of issues and challenges to think about. I know you touched on financial, insurance barriers, cultural, or just information and language barriers and things like that. These are all questions I hope we can touch on a little bit more, so I can invite everybody to turn their videos back on again. And I know we started the session a little bit late, but we are still running close on time. So I think we may have five or 10 minutes to chat. And I mean, I did want to ask more about the low level of awareness among high-risk communities, but I don't want to miss out on talking a little bit more on stigma and discrimination, since that seemed to be such a strong point that all of you made. So maybe if we could, anyone can start, or I know I wanted to follow up with Tenzin because of what he said about other family members having TB before he was diagnosed, and how that internalized stigma maybe impacted what you knew about TB beforehand, and your, I guess, how that impacted your experience in accessing healthcare from then on. If you want to talk a little bit about that.
Yeah, thanks for the question. So for me, I knew very little bit about TB besides the fact that a few family members had TB. And so, to be honest, like even when I was experiencing symptoms, it wasn't even on my radar, really. And I was also thinking it was pneumonia or a fungal infection in the lung or whatever they were telling me. And so, yeah, I think that it's definitely a concern. And I also had a similar experience with stigma where a healthcare provider was sharing. I wanted to tell my employer because it's definitely impacting my work performance at the time, and why I needed to go to the clinic to take my medication every day and the interruption of the day. But at the time, when a healthcare provider told me that, they don't need to know, which is intended also to be protective, but and it helps you. It makes you ask the questions around, well, why can't I share that, or why don't they need to know? It feels like I'm telling you that it feels like they do need to know, since it's impacting me. But so yeah, I think stigma is definitely something that is also happening within the family, and there just isn't enough places and spaces that have been created within communities to share our stories. And I've also, so far in some of the work that I began with We Are TB and the Wisconsin Tibetan Association, it's also evident that TB is not the only thing that's stigmatized within our community, but health in general is stigmatized. And for example, when I was in college, this is a unique example, but I'm sure others could relate. My mom had a heart attack. This was while I was in college, and I had lived a few hours away. And I didn't even hear about this until a month later. And it was like, why wouldn't you tell me this? And her rationale is, you don't need to know because it's just going to create stress for you, and you can't do anything about it anyways. So the conversations around health and are stigmatized or just aren't happening in the same kind of maybe the ways that it would be more productive or helpful. I'll stop there.
And Honda or Alice, did you have anything to add? Because I know you've talked about just like awareness globally and also just in the communities that are most affected, and within your own family too, about stigma.
For me to reduce the stigma, I think to create an enabling environment is so important for people being able to open up to share their experience. Because, like the circle time when I was at the storytelling workshop, that is so effective because it seems like even though 5 minutes, a few minutes before the sharing, everybody I can see on their face, and even myself was hesitate to share, to really bring it up, until we're starting to open up. It seems like it is a really trustful environment that you can let go. What you have been hiding. That's what I felt myself is from that moment. I feel like I'm no more feeling shame of being a HPV carrier. So I think the environment is so important. The format, how you present it is very important. And the other learning experience that I have is I think because in the paraprofessional, like the medical assistant in the health clinic, a lot of time, with their kind of bias and stigmas and the understanding, the knowledge about HPV and also TB, they can put something already stop at the door, to accept or to listen what the patient, will be able to telling them. So I think educated the frontline, paraprofessional like the medical assistant or the CNAs is so important. To kind of broaden their knowledge, and also the storytelling part of it from a person living with TB or Hep B is very, very kind of like beneficial for them. Because by the time I was at the FQHC, and then sharing my experience in the academy for the medical assistant, they really engage and they ask me a lot of questions, being as I'm living, with the virus. It's amazing to see how was the response, the reaction to my story I was telling them. And I hope, they have gained, some good knowledge and sharing experience. And then by the time they deal with their patient initially, and then they will kind of like know how to proceed. And then the other thing I want to mention is about the nursing school. When I was trained in a nursing school in the Sacramento State U, and I feel like that we don't really have much knowledge about infectious disease, and hepatitis, talking about TB, talking about, STD. We really lack of, being trained, for the 2 years intense training as a nurse. In America, I don't know how much really their curriculum has been involved in the hepatitis B, because they are also the frontline people. They need to understand, people living with it, and also what are the community that has been heavily impacted. And then they are the catalyst, and also they can articulate to the primary care providers, mind them what to do. Well, I mean, those can be a really kind of like a micro strategy can be expanded to a macro.
Hi. So for around stigma, I like to look at it from with 3 layers. If we look at it structurally, the first layer is institutionalized stigma. So I think it stays in, different institutions, particularly hospitals, clinics, right, where medical professionals, researchers, nurses, I think that's where stigma should also be addressed. Oftentimes in medical world, we like to look at a lot of technical skills, right? Diplomas and can you do XYZ treatments, which is of course important, but at the same time, I think we should be looking for soft skills. We should be looking to develop soft skills of doctors, physicians, nurses, to make sure that they deliver humanized care, understanding that TB comes with stigma. How can we help them destigmatize? How can we empower these patients? How can we allow them to speak up on their own to demand better services? So I think we need more medical professionals with more soft skills in addition to the hard skills. The second layer I look at is the socialized or social stigma, and that's where neighbors, communities, the general public fall into, and these are all driven by myths and misconceptions, community rumors, right? For example, TB is an inherited disease. TB is only the poor disease. If you have TB, it means you have HIV. All these myths, ridiculous rumors. These needs to be debunked in the community to raise the social aspect of the stigma. The third layer is unfortunately internalized stigma. And of course, internalized stigma doesn't just grow on its own in us, right? It's created, it's enabled, it's encouraged by external factors. Those 2 layers of stigma I talked about, the social stigma, the institutionalized stigma, that lead us to believe, to accept that actually TB is something shameful, that I have to hide it, that I'm different in a negative way, for example. So these three layers, and of course for the internalized stigma, we need more psychosocial support. We need better communication from medical professionals about debunking these rumors, for example. So these three layers of stigma, I think, should be looked at it together in order to tackle stigma in a holistic way. Thank you.
Thank you so much. I think so. We are heading into the break time. There's so much more that I wanted to ask you guys, but thank you for really hitting on so many different issues that I think we could spend a session on each one, whether it's about awareness, breaking down stigma, supporting communities and helping them to speak out and use their voice to encourage other people to get involved, to speak to providers and ask for these services to be provided in a humanized way, in a way that makes sense culturally and linguistically. All of these things I know that our partners are aware of and would love to hear more about from you guys. So if there are any connections that can be made, if like feedback can be provided from each of you to continue the conversation, that would be wonderful moving forward from the summit. But I did want to thank you all again for taking the time to share your stories, even down to like very personal details that were really inspiring for us. And I hope that you're able to stay for the rest of the summit too and contribute all of your ideas. And thank you again to each of you.
Thank you.
Thank you so much. Thank you so much, everyone. Really, really appreciate. My heart goes out to all of you, Tenzin, Alice, Handa, and Richard. We really, as Rhea said, thank you so much for sharing your personal experiences, all of your amazing national and global education efforts and advocacy initiatives. I'm just very deeply, deeply appreciative, and you're receiving lots of love through the comments chat box. I am just stepping in here for just a moment to make an announcement, just a small adjustment to our agenda. So we are confirmed that the last panel for today is canceled. However, and this is due to the CDC's ACIP meeting that's happening today. However, Dr. Lebu and Dr. Wester both confirmed that they are willing to do a special webinar in the future. So we will keep everyone posted. The rest of the agenda will remain the same. We certainly encourage folks to go to any of the two concurrent workshops that will be happening right after this. The first workshop is the impact on COVID-19 on Hep B and TB services. And the second workshop is mobilizing communities to improve Hep B and TB policies. And then after that, at 4:10 p.m. Eastern, we'll then transition to the closing session, which will conclude by 4:25 p.m. Eastern. So hopefully that still fits with everyone's schedules. Once again, let's give a round of applause to our panelists here. Thank you so much, everyone, for your participation. And we'll see you at the next round of workshops. Thank you. Take care. Bye.
Thank you.